Its inability to lead has literally led to Americans dying. This is an American tragedy.
We must be disciplined about our own personal behavior, especially around the July 4th holiday, and especially among the young adults.
This is New Day with Allison Camarada and John Brennan.
Welcome to our viewers in the United States and all around the world. This is New Day. Erica Hill here again for Allison. Quite a morning, huh?
Yeah, it was. Not the kind of records we want to see.
Right, breaking overnight. Records shattered. For the first time, the country reported more than 50,000 new cases of coronavirus in a single day. 50,000. That's more than double the rate from just 2 weeks ago when the vice president was bragging about the caseload. Somehow the president is still bragging, saying, "We're doing very good." His words. One top doctor warns we're approaching apocalyptic levels in places like Texas, Florida, and Arizona, all states that just reported record cases overnight. Arizona and South Carolina reported record deaths. Several states are reporting record hospitalizations. 37 states. All the states you are seeing there in red are seeing a rise in new cases. Nearly half the country this morning is rolling back plans to reopen businesses.
Doctors are warning about a perfect storm coming this holiday weekend with people gathering to celebrate the 4th. Meantime, many cities have already canceled fireworks in an effort to keep people from gathering. The White House, though, has plans for a celebration on the National Mall, one that could attract hundreds of thousands of people. The mayor of D.C. is worried, but she's got no jurisdiction there. President Trump kicks off his holiday weekend tomorrow in South Dakota with a fireworks show at Mount Rushmore. Masks and social distancing won't be enforced while he's there. And while Mr. Trump is now once again claiming the virus will disappear on its own, it is certainly not disappearing in Texas. That state just broke a record for a single-day high for new cases, and the result, hospitalizations are surging as well. Miguel Marquez has seen the fallout firsthand. He just went inside a San Antonio hospital that is overwhelmed with cases. And Miguel joins us live this morning. Miguel, sobering to say the least, what you found.
Completely. The only way to get a really good sense of what is going on out there with this pandemic is to go into hospitals, and I am fortunate to have been in several now. What they are looking at is a rapidly rising tide of patients, dwindling number of beds. This is across the entire state of Texas, and a healthcare staff, from doctors to nurses to those who clean up the rooms that are pushed to the max. San Antonio Methodist Hospital. The lungs of a 29-year-old badly damaged by the coronavirus need a CAT scan. With patients so critically ill, what should be easy takes enormous coordination and a small army just to get them from A to B.
We are having an explosion of COVID. We aren't overrun yet, but it's overwhelming.
Overwhelming now and expected to get worse in the days ahead. San Antonio's Bexar County has seen a sharp rise in the percent of those testing positive for the virus. In just the last 30 days, the weekly average of those testing positive has gone from 3.6% to more than 20%. So many infections, increasingly moms-to-be infected with the coronavirus. Methodist Hospital now has a dedicated unit in its NICU for babies born to mothers who have it.
That picture that every mom wants of the baby being born and holding the baby, does that happen with babies in COVID?
Unfortunately, no. We have to, as soon as the baby is born, they do bring in right to us outside of the door, so it's just a very brief moment that the mom might get a glimpse.
In the womb, the virus isn't typically transmitted from mother to child, but during the birthing process, the risk of infection goes up, and treating newborns with the coronavirus, much more complicated. Though these babies have tested negative, they are treated as suspect positive. Healthcare workers wear full PPE, and these babies born to moms with the coronavirus are kept separated from others, just in case.
You have 5 babies in here right now.
Yes.
You have room for 16.
Yes.
Do you think you're going to be full up?
I do. The way things are going, we're admitting pretty frequently.
Christy Lavacida, only 36 years old, is expecting her 4th child. Both she and her fiance have the coronavirus.
Mainly the thing that really hurt was my bones were just, I couldn't lay down, it was just hurting.
Your bones?
My bones.
Like your entire skeleton,
like
your body?
you get into my toes.
Pregnancy hard enough without that. She took precautions and isn't sure how
Says
she
him.
got it. Now, only hoping she recovers and she, her 3 kids, and fiance are coronavirus free by the time she gives birth in about a month.
I'm extremely stressed. I am a very strong woman. I tend to do a lot, and now that I can't and I need that help, it's taking a toll.
Methodist Hospital may be seeing the beginning of a sharp increase nationwide of moms with coronavirus giving birth.
There's actually some literature out there to support it to a 30% asymptomatic rate. So that means 30% asymptomatic rate
Of moms coming in?
of moms coming in.
Pregnancy and coronavirus, only one piece of the pandemic. Methodist Hospital treating a rising tide of critically sick patients.
The last few weeks has just been overwhelming, is how I would describe it. There's been more and more patients than we really know what to do with. The patients are getting younger, and they're more sick. And
How much younger?
it's gone from, probably in 50s and 60s for the first wave to, I've lost track of how many people in their 20s.
This is Methodist's COVID Unit 2. It's one of 3 specialized COVID units at the hospital. Patient rooms sealed off, each one turned into negative pressure chambers, so staff only need to don PPE if they go into one of the bays.
So you have 14 rooms. How many are filled?
14.
Wow.
With a waiting list.
How long is that list?
It's long.
The hospital is creating more beds, but for now, this is where the sickest of the sick are treated.
Well, yesterday was probably one of my worst days that I've ever had.
Why?
I got 10 calls, all of whom young people who otherwise would be excellent candidates to be able to put on ECMO. They're so sick that if they don't get put on, they don't get that support, they're probably going to die. I had 3 beds. And just in making that decision, being able to figure out who really is going to benefit, it is a level of decision making that I don't think a lot of us are prepared for.
Those calls coming from other hospitals across South Texas with patients so sick that Methodist may be their last hope. Methodist Hospital uses a procedure to oxygenate the blood and keep patients off ventilators. It's called ECMO, or extracorporeal membrane oxygenation. Today, Dr. Della Volpe is inserting large tubes in the veins of a 33-year-old. They run from the groin all the way to the heart. The blood comes out of the body, is mechanically oxygenated, then returned back to the heart almost immediately. The Methodist team have had a lot of practice, the procedure taking only a few minutes.
It involves being able to take large cannulas. They're almost like small garden hoses, is how I would describe them. They have to be able to pump about 2 or 3 gallons of blood per minute through them. So one is draining blood out, and the other one is returning.
The blood coming out of the patient is dark. It just looks unhealthy. The blood returning is bright red, loaded with oxygen. Almost immediately, oxygen level in the patient's blood goes back to near normal. Their chance of survival now better than if they were on a ventilator.
I think the ventilator really causes a lot of harm, and we're finding that it causes harm in general, but it certainly causes harm when we're talking about patients with COVID.
Because their lungs are so weak to begin with?
Because their lungs are so weak, and because probably there's other reasons why patients are having trouble.
The ventilator is pushing oxygen into the lungs.
That's right.
Into damaged lungs.
That's right. So not only are you having all of the problems with the blood vessels and the clotting in your blood vessels, not only are you having all of the problems of oxygen not being able to get to your organs and your organs shutting down from that, but now you're artificially pushing air into your lungs and causing more damage that way.
Another hard lesson of the pandemic and a virus healthcare providers everywhere are still struggling to understand.
We don't quite understand why one person with lab values of X does well, while a person with lab values that appear to be better doesn't make it. And a mask is not a big ask to help save your life.
The work and stress for healthcare workers everywhere crushing. With rates of infection rising, they expect more work and stress ahead. Stressful for patients as well, who are sick, isolated from everyone.
How tough is it to be in your room all day, just sitting there?
Oh man, it
if you could just hear that unit in the room, it would drive you nuts at first, but you get tested.
28-year-old Michael Vasquez works in a warehouse. He isn't sure how he got sick. He's part of a new program here to get patients up